today I will be doing an OB physical assessment. This is very important examination, especially for pregnant women. So this will help determine your fetal status and your condition as well. So can you please state your name and your birth date? Okay.
Next is to gather all equipments. While checking for the patient's blood pressure, observe the respiratory rate. So while we are checking for the patient's vital signs, we should also observe for the general appearance. Note for overall impression of a woman's health and well-being. Observe on the manner in which the woman's health dresses, the way she speaks, and body posture. Inspect for signs of careless hygiene.
So I'm gonna inspect your skin, ma'am. Is that okay? Yeah, that's fine. You can just do it. So the next part that I will be assessing is your head and scalp. So is that okay for you, ma'am? Okay, let's start. So, spec ko lang kung symmetrical man ba lang imong ulo. May tenderness. Magbukad lang ako sa imong hair. May graphical. Or mga masses. Wala man. Palpate lang ako. So, ang mga head and mga scalp are normal man. Wala man any problems sa imong skin color, symmetric matanan. So, the next part that I will be assessing is your eyes, your pupils, ang iris mo. Okay.
Examine cornea, lens, iris, and pupil. Note for the conjunctival color. Inspect for any visual disturbance.
So I'm done assessing for your eyes, your pupils, and for your iris. So the next part that I will be assessing is your nose. So I'm gonna check if there is any nasal congestion sa imong nose. So is that okay for you, ma'am? Okay.
Inspect the nose if there are any nasal congestion.
So the next part that I will be assessing after the nose is your ears. So is it okay for you? So let's begin.
So for the ears, inspect the ears using a pen light.
So I'm done assessing for your ears. So I will be proceeding to your mouth. Is it okay if I assess your mouth, your teeth, and especially your throat? Okay. So, ma-start ako sa iyong mga teeth. If may mga and sa imong mga gingival tissue, if swollen bala or may redness. Then, okay, ma'am, is it okay if you open your mouth so that I can assess your throat? Okay, so ma-start kita assess ang imong throat. So, pwede ikaw ka mga matanaw ko if may redness na sa imong throat or may gabanog pala sa throat mo.
Dila, ma'am.
Pwede mo mapagway mo dila, ma'am. Sa babaw. Matanaw ko dito sa kilid. Sa sulod. Wala man discoloration sa imong throat. Wala man may gabanog. So, normal yung mga throat mo. So, the next part that I will be assessing is your chest and your thorax. So first is inspect. Inspect ang iyang breathing. Normal ba ang breathing niya? Your respiratory rate. Kung normal, then ma-proceed kita sa palpate. So mag-palpate, use the palm of your hands. So mapalpate ko ang hindi man yung magsakit para mabalaan ko if may mga bukol-bukol bala sa imong chest. Tenderness, sakit ko mamon ko ni. Hindi. Sige. Okay. Next, ma'am, ma-proceed kita sa percuss. So, let's start. Ma-percuss ako sa imong chest. Okay. So, after some percuss, I will proceed for the auscultation of your chest. So, ma'am, kailangan ko ito naman tayo. So, proceed na ko for auscultation. So, mag-auscultate. May bilaterally sounds, wala. So, normal. Now, ma-proceed na kita sa imong heart now. So, first is I'm going to palpate for the apical pulse. So, i-expose ko lang yung mga chest. Then, I will proceed sa pagpalpate sa apical pulse, which is diri makita yung location for the apical pulse. Palpate. Then, I'm proceed kita. So, there I proceed. So, mamati ako sa imong sound. Kinawa ng dalong. Inhale. Exhale. So far, okay na rin yung heart rate. So now, ma'am, I will be assessing for your breast and your nipple. Is it okay if I assess your breast and nipple? Okay. So what I'm gonna do is I'm going to palpate your breast. Sakit? Do you feel pain? Then, let's see kung symmetrical ba ang breast and ang nipple. And I will now proceed sa heat ng imong breast. Kung init bala or warm lang. And for the color, so normal man tanan nga color. Sige. So now, ma'am, I will be checking for your back to see if ano bala sa imong spinal cord, sa imong back, if ni balang naglain, changes sa bag mo.
For the back, observe for exaggerated lumbar curves. I have scoliosis, kyphosis, and lordosis. So lordosis is very normal, especially for pregnant women. I will be performing the Leopold's maneuver. So this will help determine the fetal presentation and position by systematically palpating the gravid abdomen. Is that okay? Yeah, sure. So let's start.
So first is to expose ang abdomen sa mother. Then expose by pulling up the gown. So now na ay nakita sa abdomen sa mother, we're gonna start for the Leopold's maneuver. So Leopold's maneuver 1 is dali sa top. And now I will proceed for the Leopold's maneuver 2, which is dali sa kilid. Now, for the Leopold's maneuver 3, so ang nga kamot di above sa symphysis pubis, then ari nga kamot diri sa may area sa abdomen. So, isinayon talang tap. And for the last is for the Leopold's maneuver 4. So, ma-stand kita sa left side ng patient. Then, we'll start palpating sa may symphysis pubis ng mother. Slowly. Okay.
Now I will start measuring for the fundus height. So in measuring fundus height, place the 0 mark of the tape, measure at the uppermost border of the symphysis pubis or the uppermost border of the uterine fundus. Run the tape measure along the midline of the woman's abdomen to the uppermost border of the uterine fundus. The patient's fundus height is 27 centimeters, which equals to 27 weeks. Now I will proceed for the patient's genitalia. So inspect external genitalia, note for hair distribution, color of skin, varicosities, and scars. The rectum, inspect the anus and the rectum. Note color, varicosities, lesions, tears, or discharge.
May inspect kita for the legs if there are any varicose veins. So, expose the legs of mother. Then, you're inspect for any varicose veins sa iyang legs.
Next is to obtain knee and ankle reflex.
Knee reflex. So, ang knee, i-assume ta lang nga ay dito yung knee sa patient. So, gapitik bala ang tiil sa patient. Then, I will proceed to the other side. So, ari di yung knee.
Next, observe for waddling gait. So one way to describe waddling gait is that it is similar to how penguins walk. So that is all for my OB physical assessment. Thank you!